Hello and welcome. And I just want to give you a little update about after I did the nicotine patch for the third time. It's been about a month. And this last round, I only did like half a patch for 9 days. I was trying to see like, hey, if a can I do a lower dose and will that have the same effects? I was planning to do it for 14 days ish, but I started to get skin irritation from the adhesive in the nicotine patch, which sometimes I get, and I don't know why, like it started to bother me. It's like such a small amount, and I change the location every day, different parts of my body. But to me, that was just like a sign, like, okay, enough. Your body says no more. Uh, and I would say, like, I feel like for me, using half a patch did not have any lasting effects. So this is all kind of trial and error, right? I feel like if you're on this long COVID journey, we're all just sort of trying to figure it out on our own because there's really there's no medical treatment. So yeah, that's what I realized. So I'm actually gonna do it again. I think now, starting soon. And I'm gonna do the full patch, so just the low dose 7 milligrams. So I'm gonna try to see if I can do it for like up to 14 days, how long my body will tolerate the adhesive, and see if I have lasting effects. So the first 2 rounds I did like the 7 milligram patch, the full thing, for I think 7 to 9 days each time. And I would feel better for about a month. So the third time I was trying to see like, can I do half a dose for 9, however many days? And will that have the same effect? But it didn't. It really didn't have any lasting effects. And I told myself, because kind of what happened after the first couple times that I did the nicotine patch, after like a month, it wore off. I would start to feel really fatigued, and I would just like be like, oh, it'll go away, and it didn't. And then I would be like, why did I just suffer for like 7 to 10 days before I did something? So I told myself, like, if I start to feel fatigued for more than a day or two, I'm going to do the patch again. So since that time, there's been 2 or 3 times that I felt really fatigued for more than a day. So I did just a quarter patch for 2 days straight, and then I sort of stopped. I can't remember like why I stopped. Honestly, I used to track everything like so specifically, and then now I'm just like not tracking as detailed. Kind of just going by how I feel. So I did do that. So that's why I'm like the half a patch for 9 days didn't have any lasting effects, because at least twice since I stopped that, I've done a quarter patch just to kind of like give me some oomph, I guess, get me out of the chronic fatigue slump. So I'm going to start again with the full patch, see if I can go more than 7 days, just if my body will tolerate it and how long that lasts. I'm like, if I have to do a week of the 7 milligram patch once a month, like, I don't know if that's what it is. That's what it is. I still always go back and forth. Like, should I see my doctor? Should I ask for a medication? I don't know, because the road has been really up and down, and I'm sure if you're on this long COVID journey, you probably are experiencing this too. But like, sometimes I feel great, and for like 3 to 5 days, I can be physically active, and I'm fine. And then sometimes I will just be exhausted. And sometimes it follows like doing a lot of activity, and sometimes not. Again, I'm like not tracking things super specifically, so I'm kind of just winging it. But yeah, it just feels like, to me, frustrating, like just the up and down of it all. Yeah, I would really wish it just to be over with and to feel normal, but I don't know. I'm guessing for myself, probably a year or two. I think most of the research I've read, it's a lot of people, it's like 13 months to 2 years is kind of like what I see, which, I'm trying to tell myself, if there's an endpoint, that's good. These are the conversations I have with my patients every day that have chronic illnesses too. I'm trying to be patient, but I'm not patient because I like to be physically active. So what else can I say? Yeah, I'm quite nervous. It's September now, for the upcoming like germ season, cold and flu season, because I'm a physical therapist. I work in close contact with people. This is how I got COVID in the first place. That became my long COVID. Um, so I'm quite nervous. So I'm starting to wear my mask again more at work. I'm trying to wear it with all my patients, but it's I don't love it. I don't hate it. I wore it for like 4 years straight, and then when I stopped, someone gave me COVID. So I'm trying to wear it because I know like germs are gonna start circulating again. School started, kids are getting sick already. Um, in California, supposedly we hit our peak of our summer COVID wave. I only really know a handful of people that had COVID. I think also just people aren't tested anymore. It's maybe mild for a lot of people. Mostly, I think just people aren't testing. But according to like the wastewater surveillance, it's like we had a COVID surge this summer, not as big as last summer, pretty small, and apparently it's like on its way down. I'm also trying to consider when I'm going to get my vaccinations. I am not saying anything to you about whether you get vaccinated or not. That's your choice. Always get all the hate comments about vaccinations, but I personally am a healthcare worker and I choose to get vaccinated. And I'm also kind of curious if another COVID vaccine will help me. I did hear people talking about that. Sort of like that helped some people in their long COVID, but the research, I looked up research on it and it showed it wasn't like statistically significantly different. Um, so I don't know, but I'm kind of curious. I live in California. Supposedly, everybody should have access to get a COVID vaccination if they want. I know it is kind of a hot mess out there because national politics are changing, approval of it. Again, you can have your own opinion on it. I'm just saying what I see as a healthcare worker and sort of what I want to do. So, my plan was to wait a little bit later in the season to get my COVID and flu shot, like the end of October, early November. So it's like more towards the peak of the season, so I'll have more protection. Because my freaking patient that gave me COVID last year, it was like the very end of the season. It was like mid-February. I remember the exact date. It was President's Day. I should have just taken that day off of work. Um, but anyway, sort of it's fall, it's, cold and flu season's coming, it's vaccination season for people who choose to get vaccinated. So I'm sort of thinking about that and then hoping I can still get the COVID shot if I want it next month, which I think California made its own rules and it should be accessible. We will see. It is a wild moment in healthcare in America right now. So anyway, the other one thing I want to say is, as a female, um, whenever I have my period, my menstrual cycle, along with long COVID, is a bad combination. And I don't know if any other females, if you feel this too, but I feel like when I have that period, I am just like exhausted for a couple days. Menstruation and long COVID is just like a killer combination for a few days. I'm pretty exhausted for the first 3 days of my period with the long COVID. So sometimes that's a factor too. I feel like even if I've been feeling good, like once my period hits, it's, yeah, exhausting for a few days, and then takes time to recover. So I don't know, maybe I should time the nicotine patch to be like right before my period. I'm not to that detailed yet. But anyway, just one other observation as a female, that is like pretty rough. Yeah, normally like before long COVID, my periods were like not bad. Like, I feel kind of tired, but like kind of crampy for a day, but like functional. But I feel like long COVID plus the first few days of my period is like I'm pretty exhausted. So I think that's about it. It's sort of just up and down road, always trying to figure out like what's the next step, what's the best timing of anything. And I am really trying to not get sick because I'm terrified of like what's going to happen to my immune system if I get sick while my immune system is already fighting this long COVID and like not recovering normally. So that part is pretty like I'm pretty anxious about that. So I'm doing my best. I don't want to mask everywhere, but I definitely am like masking at work more. I'm gonna go on a trip pretty soon. I always mask on flights now in airports because those places are full of germs. That's just, I will do that probably forever from this point forward. And yeah, so let me know in the comments if you have any questions or sort of how your journey is going, if you want to share or anything that's helped you. Yeah, if you've taken any medications, let me know. I'm like, I go back and forth all the time. Like, should I, shouldn't I? Is it worth it? I don't know. Okay, see you next time.